I'm going to try to cover a subject that normally would take about 8 or 9 hours in 10 minutes. And so strap in, we're gonna move through this very, very quickly. So we've heard today from a number of people why telehealth is a win-win-win for the consumer, for the provider, and for the doctor. And for a number of reasons, it's just a much more efficient way of delivering care. But patients have not adopted for whatever reason. Right now, we're still under 1% of healthcare spend. And as you can see, although it looks like a rapid rise, we're still hindered in terms of our growth. So why have patients not adopted? Well, there's a number of reasons. We've heard a lot of them, but HIPAA is sort of my personal favorite because once you actually get a patient, it's very hard to continue to communicate with them without getting opt-in. But these are the other reasons that we see a lot of hindrance in terms of people using or trying telehealth. Everyone I've talked to who's tried telehealth loves it. One thing I want to stress is inpatient telehealth is not in-home telehealth. And inpatient telehealth may help you in terms of getting to specialists or seeing people who are not in your area, but you still go through the same inconvenience as a patient to schedule a session. And you have to go to the doctor's office. And so really the experience is not that much different than a traditional office call. So this particular slide was done by Chilibark Research in 2016, and I would argue that we're still very much in the first wave of telehealth adoption. The second wave, for the reasons I just spoke of, we're not there yet. So how can you be found when you don't have a location? A hospital has a lot of built-in advantages in terms of its tentacles, one of them actually being the physical space. This is my mom's hospital. And she doesn't really have much of a choice in terms of it's the hospital in Orange County that she has to go to. So the way we're gonna solve this problem is through search marketing. And search marketing is not just natural search or paid search, but there are a number of different augments to it. So site searches are very important. We've heard about social, voice search is coming on. So there's a number of ways that we can communicate or attach to the consumer through search marketing and good search marketing principles. So search optimization is really patient optimization. When you create your website for search or your app for search, you're actually making it easier for the patient to do business with you. And you're making it a lot easier for the patient to come back and buy from you. So as you see here, more and more, these are Google's search criteria. There are a lot of things on here that are beyond sort of what you would think about as being traditional search. A lot of it, today is how fast does your website load? Is it set up for mobile? And we'll talk about that in a second. So again, one of the criteria that Google's using now is what we call dwell time, which is how long is the person staying on your page? Are they finding what they're looking for? Are they transacting? Or are they abandoning? Are they finding your content useful? Are they finding what you're offering useful? Is your content being shared? Right now, the average dwell time for a top 10 Google result is 3 minutes, which is a long period of time when you think about it being on a web page. So I'm going to talk really quickly about ways that you can optimize your website or apps. The first is starting with patient intent, and that is you can do that through keyword research. One of the easiest ways to do that is just to type in the search and see what Google suggests, but you can also use Google's paid search tool to get actual lists and volumes of keywords. One of the things that is very interesting is that people actually look for telemedicine more than they look for telehealth. They look for online doctor a lot more than they look for telehealth. And again, so one of the things that problems we have is there's a confusion. If you go look for telemedicine, telehealth, you'll see a lot of platforms. You won't see online doctors per se. We can also track usage by area, and this is Google Trends data. The other thing we could use search for is to track our competition. So this is Amwell. You can see that Amwell started advertising pretty heavily this year. We can tell where people are coming from to Amwell. We can tell where people are going from Amwell. We can actually look at all of their ads and see what messages are actually resonating with consumers. Third tip is to obviously optimize your web pages for search. A lot of times, like for example here with Amwell, they've got images that are loading very slowly, which is hurting their search results. One of the other things that's very important today is to use rich snippets, which is a way of communicating to Google directly as to like doctors' names and locations. Here is a healthnet.gov piece that, again, shows up as content on the web page, and again, is going to get people to go to that website. Here are all the things that you should be doing on your web page. And again, these are sort of what is known as on-page optimization. Here again is, oops, I went backwards. Really important today is to start optimizing your website first and foremost for mobile. Here you can see that Amwell gets a very poor score. They've got a great score for their desktop, but their site is not responsive for the phone. And today, 65% of all searches are done via a mobile device. Fifth tip is to claim your Google business. Amwell unfortunately did not do that, and Monica picked up their listing, which again, she's able to, basically is getting traffic off of their traffic. Publish and distribute high quality content. Again, create content with the patient in mind and make it useful. It's better to do a quality job than have a lot of crap pages. Leverage search and social holistically. We've heard a lot about that. Your ratings are really, really, really important. And Google is actually looking at your Facebook reviews. It's actually looking at social shares. It's actually looking at what your general reputation is out on the web. Very important today is to optimize your website for voice. Voice searches are growing dramatically. They're up 35%, 35 times since 2008. And they're now 20% of all searches. Create compelling video. This is something really important in telehealth because, again, people do not understand how to interact or start a telehealth session. And video is very, very underutilized, and YouTube is already the second largest search engine next to Google itself. Create a secure site, and this should be obvious, but it's amazing how many sites are not HTTPS and do not have security certificates up to date. And again, this will void you on being seen on Google. It will also give a bad user experience. Convert visitors into patients, and this is really important, is conversion optimization. So once you get someone to the website, make sure that they're not abandoning, and always be measuring as to why people are abandoning and fixing that. And along those lines, it's always be measuring and testing your website for, so it's running optimally. And then lastly, help patients build your brand. These are some things that Gardner came up with, but I think they're really good structure in terms of improving your search results. And that is it. I'm at time. Thank you.
Thanks. We have some time for some questions?
Oh, yeah.
Any questions? Can I say, like, from your experience, like, roughly what percentage of these were physicians or hospital who's sort of good at marketing versus
Very, very few.
very few?
I worked for Kaiser for 3 years, and we have a great TV campaign. But digitally, very, very backward. And HIP is part of that. Part of that is the hospitals don't feel like they need to market because they have you. And so I think that's really the opportunity for telehealth, is to get in front of the consumer and make it a patient-first experience and make it a patient-first pitch, because there is a void there.
Okay. Do you have an example of someone in the healthcare who does really good marketing, like example?
There's probably someone in this room, but there's really not that many. And again, you would say, well, they have a good TV campaign, or they have a good website. I worked on the kp.org website for 3 years. You compare the experience of going to a medical portal, which most patients, only about 30% of patients do go to going to, let's say, Amazon or a consumer website. It's very, very different. And tends to be user unfriendly.
Okay. Any questions?
So compare KP to Amazon. How would you say Amazon, besides the fact that you're buying something?
Right.
How would you say that experience is different? Oh, I'm so sorry.
Well, for example, kp.org, when I was involved in the redesign, at one time had 3 homepages. The homepage itself would literally, it was a site onto itself. It was very difficult to navigate. Search did not work. So if you looked up foot doctor, you would not find a foot doctor. So again, sort of basic things in terms of making it easier for the consumer to buy or to transact or to learn weren't there. And again, because they weren't selling something, in some cases, they weren't measuring results. So, for example, the kp.org site for a long time would take a minute and a half to load, which, again, if you've got a health condition, that's way too long.
So when it comes to the reviews, I know when I'm reading general marketing things, it says, I always know, thank people for it, respond, 'cause it's going to help build the engagement, so to speak, in your ranking. But as physicians here, I'm not saying you're responding to negative ones. I can't even respond to, can you respond even to positive ones? Sure. Or is that breaking HIPAA, because then you're saying, yes, this is a patient of mine, or yes, they received services?
So that's a fine line, but once the patient has actually reviewed you, then they've given you permission to basically communicate back. And again, I'm amazed at how few hospitals actually look at their reviews and monitor them. I mean, they should be responding to all of them, good, bad, and indifferent. Thank you for the good review. Or, I'm concerned that Dr. Smith didn't take care of you, quote unquote. And again, there's a lot of resistance within the community to allow reviews for that reason.
Yeah. Thank you.
Great. Thank you so much for that.